I'm Katie, and Ashley's with us too. We're both instructors at Webb Skin Institute, and we are just going to go through briefly the State Board practical bag packing, how everything is labeled, and what supplies need to be in each bag. So a couple of things that you should always remember with your State Practical Board is that your bag that you bring is never placed on the counter. It should always be on the floor, and it always needs to be kept closed, no matter what. Always zip it back closed as soon as you have finished taking out the bag that you need. So the first bag that you will need to have on hand, first of all, you'll need to have hand sanitizer laying right out front. That should be the first thing you should be able to grab, okay? Hand sanitizer, labeled hand sanitizer. The state does not prefer brand named products. I've actually read that you should black out or put tape over the brand name label if you use brand names in bottles. So something labeled hand sanitizer. Your first bag that you'll pull out is your pre-exam setup and disinfection. It should be labeled just like that in a gallon-sized bag. And then inside this bag, you are going to have a smaller bag labeled trash bag with your trash bag in it. It's recommended that you have a drawstring. It just makes it easier at the end of your service to drawstring it closed. That's the only thing in that bag. You will have your container of EPA. It should be labeled EPA registered disinfectant. That's how the state requires it to be labeled. EPA registered disinfectant. The last thing that you will have in this large bag is going to be your blood exposure kit, and it should be labeled just like that, blood exposure kit. Inside this bag, you will have 2 bottles. They can be spray bottles or they can be pop open bottles. One labeled disinfectant and one labeled antiseptic. Also in your blood exposure kit, you are going to have a bag that is labeled pre-sanitized implements. Pre-sanitized implements. You'll have multiple bags throughout that have the same label on them. And in this bag, you will have a few Band-Aids, 2 or 3 is fine, a few cotton rounds or 2x2 gauze pads, and a pair of gloves, okay? And the last thing that you will have in your blood exposure kit bag is a bag with nothing in it labeled blood exposure bag. And the reason that this needs to be in there is because in the instance that your client did spill blood, everything that you used to clean up that blood spill and stop the blood, like the gloves you would put on, the gauze that you would use to dab the blood, would need to get put and sealed in this contained blood exposure bag. So those are the things that we have in this first bag that we have labeled pre-exam setup and disinfection. Moving on to the next bag. Next bag is going to be labeled just sanitized implements. I've also seen the bag labeled fitted sheets is also fine, I believe. In this bag, this is for your client setup, and it is going to have your fitted sheet that you'll put over the chair. It will have a towel that you will use to drape your client. It will have your head wrap and your shower cap to contain the hair. If you opt to, you can also use hair clips to secure the towel back behind your client to ensure that it doesn't fall off of them during your service. And you can also use smaller hair clips to secure the head wrap and the shower cap if you're worried about that coming off during your service, or during your practical. So that is the only items that are kept in the sanitized implements bag. Next up is going to be our skin cleansing service. And big bag labeled just like that, skin cleansing service. In this bag, you will have a bag simply labeled wet towel. This will be a truly wet towel in this bag that you will use to take off your cleansing product. And then you'll have another bag in here labeled Skin Cleansing Service as well. So you'll need to make 2 labels, or you'll be given 2 labels that say Skin Cleansing Service. In the smaller bag, you will have another smaller bag that says pre-sanitized implements. These are implements like sticks and cotton rounds that you may need to use for the toner step, and for getting product out of any containers that you can't stick your finger in. So for instance, if you use containers like little sample cups, just like in practice, we never double dip and we never put our finger in product. And so you would need to have a stick to scoop the product out of the container before using it. I recommend also having, always in every bag, having extra sticks, extra gauze, just in case you drop something on the floor or your product drops on the floor. So cotton rounds for your toner, sticks if you use a container where you can't put your fingers in it. And then your 3 products that you'll need will be the makeup remover for your makeup remover step. Oh yes, and you also need cotton rounds or gauze to remove their eye makeup and lipstick. You will need a toner and you will need a cleanser. These things should be labeled exactly like this. Like I said earlier, you can absolutely use actual bottles of product, but it is recommended that you black out or tape out the brand name of it. So that is all the items that are in the Skin Cleansing Service bag. Moving on to our next service is our face and neck steaming service. This is a super easy bag. It's got 2 things in it. For face and neck steaming service, it has got a bowl, which you don't have to label, and a towel labeled wet towel. Okay, whole purpose of this bowl is that when you're doing your face and neck steaming service, you do need to demonstrate taking the towel, mock wringing it out, and then temperature checking. And so that's what they'll be looking for with that. And so that's where your bowl comes in. So just the mock wringing out of the towel. So next up is our face and neck massaging service. Bag should be labeled just like that. In this bag, you have got another bag labeled wet towel. And then you will have a container labeled massage product. It can be in a squeeze bottle. It can be in a sample container like this. If you use a sample container like this, you absolutely do need to have a bag labeled pre-sanitized implements that you'll have some sticks in so you're not dipping your finger in the cup. And then it's good also to have a couple gauze or cotton rounds, because part of the lingo that's used in the practical exam is that you should use a sponge gauze towel to remove any excess product. And so if you do have some excess massage product on the face, you'll just gently, go over it with a gauze or cotton round to take that off. So that is the only items that need to be in the face and neck massaging service. Next bag up is the mask pack and moisturizing service. So in your mask pack and moisturizing service bag, you have got the last wet towel that you will need. So bag with wet towel, that puts us at 4 wet towels in 4 separate bags. And then you'll have another bag inside the bag, also labeled mask pack and moisturizing service. Inside this bag, you will have another bag labeled pre-sanitized implements that will have sticks and cotton rounds or gauze pads in it. And then you'll have 3 products in this bag. You will have your mask, your toner, and your moisturizer. So the items should be labeled just like that. They should be labeled toner, mask, and moisturizer, okay? These can also, depending on what consistency product you use, they can be in sample cups like this, or they can be in squeeze bottles that you use. I highly recommend with your mask that you not use a mask that is too runny and you don't use a mask that is too thick. You want it really easy to remove because your rater will really want to see that you've removed all of the product residue. I recommend that it has some sort of a color to it, a light color. They need to be able to see that you've applied the mask evenly and all in upward directions. Also, you want it to be not so thick that you have difficulty applying the mask, and so you'll need to apply it with a fan brush, all in upward strokes and avoiding the eyes, the mouth, and the nasal passages. And so choose your product very carefully when you are picking your mask. So again, mask pack and moisturizing service, 3 products labeled moisturizer, mask, and toner, and then our pre-sanitized implements. If you are not using a sample cup, again, and just using squeeze bottles, you wouldn't have a need for a stick, but you absolutely will need some cotton rounds or gauze that you can use to apply your toner or to remove excess product. Moving on, our next service in the State Practical Board is our eyebrow arch service using tweezers. In this bag, you'll have 2 products and a pre-sanitized implements. Your 2 products are going to be your astringent and your antiseptic. And then your pre-sanitized implements bag will have multiple things in it. It needs to have at least 2 pairs of gloves. Don't ever come with no extras because gloves like to break, you can drop one on the floor, you always need to have an extra set of gloves. So I've got 2 full pairs of gloves in there. I also have plenty of gauze. You'll need to remember that you'll need 1 gauze pad for antiseptic, 1 gauze pad for astringent, and then also 1 gauze pad to place on their shoulder. So when you're tweezing their hairs and demonstrating that you've removed at least 6 hairs, you place those hairs on that gauze and they will look at that. So, and then this is my mock tweezer. So you need to have your pre-sanitized tweezers. And then I just threw some sticks in here just in case I needed them, but you don't really need sticks for this section of the test. So that is it for our eyebrow arching service using tweezers. The last bag that you'll need in your practical state boards is your eyebrow arch service using cold mop wax. And so this bag is very similar to the tweezers section. You're still going to have your 2 bottles, one with antiseptic and one with astringent. The only other product that you're going to have is your mop wax. And then your pre-sanitized implements. Again, at least 2 pairs of gloves. You're going to need same amount of gauze pads to apply astringent and antiseptic. You will need some sticks for your mop wax. I always have at least 4 sticks in the bag. And then a handful or so of just wax strips, okay? Recommendation for the mock cold wax, Vaseline works best for a couple reasons. First of all, it applies super easy. It's got a little shimmer on it, so the rater can see where you've applied that mop wax, and also Vaseline, the wax strips stick really well to Vaseline, so it makes it really easy for you to mock the applying it, having it stick to the face, and then the removal parallel to the skin and in the opposite direction of hair growth. And so Vaseline works hands down best for your mock cold wax. So, like I said earlier, make sure you have extras on stuff that is most likely to get dropped on the floor or tear. These items labeled just as they are is what the state recommends for labeling, and that can also be found itemized on the PSI bulletin, the candidate bulletin that you will get at psiexams.com. And then if you have any other questions too, you can definitely ask any one of the instructors here at AWSI Skin Institute. Have a good day. Thank you.